Okay, thank you for staying with us. I'm joined by two brilliant ladies on the show this morning to share with us on a very topical issue. At the top of the program this morning, I made reference to pneumonia and the danger it poses. So quickly, we want to start the conversation. I begin from my immediate left, where I have Ayebo Sado. She's professor of child health at the University of Benin and consultant pediatrician at the Institute of Child Health, University of Benin Teaching Hospital. Prof, thank you for coming on the program.
Good morning, and good morning, viewers.
It feels great for me knowing that I've been able to drag you from within the four walls of the hospital this morning, right? Okay, next to her is yet another lady, Tessie Eyakwano, Deputy Director of Public Health Nursing, Institute of Child Health, University of Benin. Thank you as well for coming. We appreciate it.
Thank you very much.
All right. I want to begin with you, Prof, right? When you talk about pneumonia, especially within informal circles, I think the assumption is that it's in the range of cold, fever, catarrh, malaria.
It is a very serious business when it comes to children, because it's responsible for up to 700,000 deaths yearly.
In this country?
No, globally.
Globally,
But Nigeria has the highest number of deaths from pneumonia amongst under fives of all countries in the world.
That sounds serious already.
Yes. So we lose about 140,000 children every year to pneumonia in Nigeria. So that's not...
Yeah, it's interesting. I was looking at something this morning, and I saw, for example, where you're told that the awareness is very low. And that in itself is a problem, because as a teenage boy growing up, I had witnessed a neighbor who died, as we were told, of pneumonia. People still didn't take it very seriously at that point. What does that say about the level of awareness?
Well, many parents do not know what pneumonia is. They just think that the child has been exposed to cold, and that is why the child is coughing.
Right.
But by the time a child has cough, catarrh, fever, is breathing fast, is having difficulty in breathing with chest injury, then that child is very sick and needs to be in hospital. So you don't wait until it gets to that point to get to the hospital. So that is why the Coalition Against Pneumonia celebrates November 12th every year to create awareness about this serious disease.
Has it improved awareness significantly?
Well, yes, I would say that, because the cases of pneumonia have decreased considerably.
Right.
In Nigeria, the rate of decline for pneumonia is just 2% every year, and that will not be enough to achieve the target, which is to reduce the number of deaths to 3 per 1,000 live births. Currently, Nigeria is at 22 per 1,000 live births. So if we continue at this rate, we will not get to that target until after 2050. So that is why
2050 is 30 years from here.
Yeah. So that's why we must have all hands on deck to ensure that we reduce.
I want to talk to Tessie about something that's also very crucial to this conversation. Mortality, right? Experts like yourselves are now saying that mortality can be largely attributed to things like low immunization, malnutrition. Then they also talked about things like pollution, for example. These are very critical elements as far as pneumonia is concerned. How are we dealing with these issues in Nigeria, for example?
In the public health sector, we try as much as possible to educate the mothers, especially when they come to the clinic. We educate them. We tell them, look, you just have to breastfeed.
Right.
You have to keep your environment clean. You must protect the child against cold. Because at times when they expose these children to maybe fan, in a room where you have maybe about 3 or 4 children staying together, you expose them to things like dust. There are so many things that can cause pneumonia. So we try to educate them on all this. But exclusively we say, please breastfeed your child or your children for the first 6 months of life. Try as much as possible, because that one gives a lot of protection. And
then you say breastfeeding continues for another 2 years, then you can juggle with healthy foods, right?
Yes, while you are still... I had the opportunity of being breastfed for 4 years, and I don't think I've ever
had... You get an award for that, because it stands you out, obviously.
And honestly, it's so interesting. But
so you encourage mothers to do same?
Yes, but most of them don't want to do it because they believe, well, if I breastfeed, my breast would fall. So many things that are attributed to all this. So we try to tell them no. And when they come to our clinic, really, they are really very satisfied. They don't come the way, they don't go the way they came.
Right.
So let me just come in here. There are what we call risk factors.
Okay, what are they?
For pneumonia. So a child who is not exclusively breastfed for the first 6 months of life is at risk. Children who are malnourished, they are at risk. And in Nigeria, up to 30% of our children are malnourished. So you can understand why then unimmunized children are at risk. You talked about pollution. Yes, indoor air pollution. When parents smoke in the home, when parents cook with firewood in the room where their children are going to sleep, or the mother has a baby on her back, she's bent over her cooking pot, which is cooking over fire that is made with firewood or coal. So these are things that put the children at risk. And then, of course, underlying diseases can predispose a child to having pneumonia. So a child who has congenital heart disease, a child who has sickle cell anemia, a child who has HIV. All these are predisposing factors.
I want to talk about immunization with Stacey quickly, right? Our culture, I mean, our disposition to immunization, some persons say is still not where it ought to be. People still have skepticism, they still have misgiving, misconception and everything else about immunization in this country, which means that there's a layer of several things we have to deal with to be able to address issues like pneumonia, for example. And then we live in a country where apparently we have healthcare system that is, for want of better words, fragile. So how much of challenge are we dealing with right now?
The challenges are not much now because actually most of them have agreed that, well, immunization is one of the reasons why the babies will not be exposed to pneumonia. So most of them, and because it is free, it's accessible, it's affordable, we make it as much as easy for them to come to. Even when they don't come to the clinic, we call them on phone, they come. So most of them really they are assessing the immunization for the children now. And it's given to them without, there's no cost, at no cost.
Okay, so it's not a matter of luxury. No parents can say I can't afford it. But again, I'm concerned off the top of my head now about mothers in particular who live in rural areas. There's the issue of poverty, there's illiteracy, for example, then specifically there's maybe below sizable awareness regards issues about pneumonia, because most times what you see is you bring the child close to fire, obviously to be exposed to a little heat. After all, now codes the warrior, as we say, right? We have to deal with that. But before we come to that conversation, hopefully before we're done here, I want to talk about issues around not just funding for health really, but the quality of health care. I think Nigeria largely, away from pneumonia generally, is still, I mean, most Nigerians still have not adopted health-seeking attitude. It has to come to, sadly, point of death. Somebody has to be so close to death before we begin to seek help and so on and so forth. You've talked about mothers. I mean, you both have talked about mothers breastfeeding their children long enough. Of course, sticking with the vaccine regime and so on and so forth. But there's so much more we can do to address these issues.
Right. Now, first of all, when a child falls ill, you need to get to the hospital. And what does it take to get a child to the hospital? Transportation.
Right.
And then you have to pay for the card, you have to pay for the drugs.
To access health care.
So for a lot of people, it is out of pocket spending. There is no health insurance. So because everything is out of pocket, they consider that first, and then they look to go into the nearby chemist to buy drugs. Some of them start antibiotics at the wrong doses because children grow. So if when your child was 6 months old, I prescribed an antibiotic for an infection, by the time the child is 3 years old, the dose I'm going to prescribe is going to be different. So we have things like suboptimal doses, wrong antibiotics for wrong indications. So these are some of the things. And the government has come in. The National Health Insurance scheme has to spread to cover a sizable proportion of our population. So when a child has cough, catarrh, difficulty in breathing, the child is supposed to get an antibiotic from a healthcare personnel. And in Nigeria currently, this is like about 27% of the cases. So you can understand why they die.
Exactly. I asked that question because what we still find till today is a parent, for example, a mother in particular, telling another mother, okay, when my child had these symptoms or showed these symptoms, this was what I did. So it becomes like copy and paste, as we say. So Tessie, talk to me about symptoms in particular, because the symptoms, from what I understand, because I heard a jingle, by the way, that centers around the same issue of pneumonia, and I heard certain symptoms. Those symptoms seem to also be similar to symptoms that are indicative of other kind of ailments or illnesses or something. So what are the specific symptoms for pneumonia?
First of all, there's cold, there's cough, there's a catarrh, you know, the nose starts dripping. Then before you get to the stage of difficulty in breathing, there's this indrawing. You know, when the child is breathing, you see there's difficulty. There's pain, restlessness, fever.
Very serious.
By the time it gets to this stage, it's already getting bad.
Prof, there's a forecast now that COVID-19 will add something in the neighborhood of 1.9 million deaths to what we're already seeing as regards pneumonia. That's a concern that we all should, that should keep us all up at night, isn't it?
Yeah. Well, thankfully, COVID-19 has relatively spared the children.
Relatively?
Relatively. So you find out that majority of the cases of COVID are in adults. And these 1.9 million that we're talking about are projected to be death from pneumonia amongst adults. A few will be from children also. But COVID-19 does affect children in a different way that people do not really look at. So, for example, what has the COVID-19 done to us as a people? The lockdown and has affected economic activities. Some parents have lost their job. And when parents lose their means of livelihood, that means that feeding the children is going to be compromised. So, malnutrition rates go up. Some children did not access immunization during the period of the lockdown, and they still have not gone to immunize their children. So the children are at risk. So it is projected that 2.3 million under 5 deaths additional to what was there before is going to happen, and 35% of this is going to be due to pneumonia and sepsis. So COVID-19 has affected services, and services that are meant for children and mothers, and so in an indirect way it's going to affect children dying.
Okay, let me ask Tessie this again. Every time we talk about pneumonia like this, it appears for the most parts the pendulum swings between the mother and the child, the mother and the child. What's the place of the father in all this? Is it going to be, as my friend would say, moral support or something?
Yes, it's supposed to be moral support. It's supposed to be not only moral support. The father should be part of the care. The
whole effort to provide
care.
Yes.
But some fathers will even tell you, no. All I need to do is provide the money. No, you should be part of. You should encourage your wife to breastfeed your children or your babies. Encourage them in anything they are doing so that they can have enough time for this children.
Okay, lastly, today is 12th of November, and then of course we're commemorating this. What message should the viewer take home from this conversation we've had so far?
Well, I'll place viewers in different categories. So we have the general population.
Right.
We want them to know that pneumonia is the #1 killer of children, and there are things they can do to protect their children and prevent the children from falling ill. So quickly, exclusive breastfeeding, good nutrition as from 6 months, in addition to breastfeeding up to 2 years. Immunize your children because there are specific vaccines that protect against the organisms that cause
from time to
pneumonia.
time.
Wash your hands, which is another way in which COVID has helped.
Hygiene now.
Wash your hands, hygiene, and this physical distancing actually does help. No smoking within the house as much as possible. Let's not use firewood, but if we have to do it, the children shouldn't be in that environment. So that's for the general population. What about government? We have spent a lot of effort on COVID. We have attracted some infrastructure.
Right.
this should not go to rot when COVID goes away. This should be harnessed for pneumonia, because severe pneumonia ends up in the ICU, and we know that we have achieved some capacity ventilators which are used to breathe.
On that front?
Yes, so government should do that. Then research, which will have evidence base for the things that we do in our country. So government should fund research. What are the other organisms that cause pneumonia, viruses and all of that? We should identify them. Treatment, what are other modalities that we can use? Equipment, what can we bring to the fore? What innovations are there? So government should fund research. Okay.
I want to thank Professor Ayebo Sado specially for making our time to be with us this morning. And then another amiable lady over there, Tessie Ekwano, thank you as well. We appreciate you, ladies, for coming to talk to us about this very important issue this morning. I also want to appreciate Dr. Ademia Wanerick, Director, Child Health Institute at the University of Benin Teaching Hospital, for running the show, as I'll put it, to help me influence these ladies to be here this morning, and the Pediatrics Association of Nigeria for throwing their weight behind this fight against this silent killer. Up next will be a conversation about the next 4 years of Governor Godwin Obaseki, who gets inaugurated for a second term today. Stay with me.